Good day, my dear students. Welcome to Spotters in Pathology. In this session, I shall be dealing with two topics, cholecystitis and cholelithiasis. These can be kept as gross as well as microscopic slides. And not only for the practicals, they can also bother us during the viva voce. Though being short, I would like you people to kindly lend me your ears. The only true happiness lies in knowing who you are. Laurel Hamilton. I would like you people to pay your attention to the picture on the screen. I am finding a sac-like structure. SAC, a sac-like structure. It is open. It is cut open and it is displaying multiple pebble-like stones or calculi. The inner surface, that is what we see when we open it up. It is pinkish brown. Sometimes the specimen might be bile stain. So you should mention the color that is there in your specimen. The external surface is pale, brownish, or brownish white, whatsoever. It is a sac-like structure. And these are the measurements. Look at this one. A sac is nothing but a purse, and then this is a noose around it, which is made for tightening it. Or something like this, which the ladies those years used to have, and now we are also falling in for it. There are multiple stones which are here, and when we observe, I find that they are having flat edges. Flat edges. My professor used to say that because of constant friction, they become flat or faceted, just like the edges of a diamond. So measurements are mandatory. The measurement of the gallbladder, measurement of the stone, and probably if you can count the number of stones. Too many, you can mention an approximate number. Again, another specimen. The cut surface shows multiple calculi. It is filling the entire gallbladder. The stones are greenish yellow. Look at the change in the color over here. Or grayish brown, as in the previous case. They are faceted because of friction. The wall is thickened. This is the wall. This is the external surface. This is the wall. The internal mucosa is not visible in this picture. So the wall is thickened. You can mention how many millimeters it is. So the diagnosis is clear. It is a case of chronic cholecystitis with cholelithiasis. For gross, we must mention only the gross features. That having been said, we'll go to the next slide. Look at this picture. This is a gallbladder. A gallbladder, it has got a mucosal lining. This is for the mucosa. Then it has got a muscular layer, M for muscular. Then there is a loose connective tissue with a blood vessel. We call it the serous. The mucosa is thrown into folds in two organs, the fallopian tube and this. You find that there will be elongated projections thrown into the lumen, which we may sometimes call plicae. So mucosal folds, muscular layer, serous. These are my references. I would like you to go to the detailed class on cholecystitis and cholelithiasis, which is a university exam question for us. So the diagnosis is chronic cholecystitis. But then what are we supposed to see? Here I am finding a dipping in of the mucosa, which is going lower down. And this is called the Rokitansky ash of sinus. Rokitansky ash of sinus. A sinus is nothing but a tract, a blind tract which is open at one end and closed at the other. This is a better picture and a superb one. I would like you people to kindly appreciate the columnar epithelium, low columnar epithelium that is lining over here. There is an undulation. There is a throwing in of the mucosal folds, and this is the lamina propria. Lamina propria will be supporting it, and I find it filled with lot of dots, which are nothing but lymphocytes. So there is a lymphocytic infiltrate that can be seen. More important is, I find that it is dipping down. It is going almost down into the muscular layer. And these are called the Rokitansky ash of sinuses. Mucosal folds, columnar epithelium, Rokitansky ash of sinus, and lymphocytic infiltrate. So your diagnosis is chronic cholecystitis. For microscopy, do not write gross features. Gracias.